Continuing with Objective 7, now we're going to interpret the meaning of abbreviations related to the cardiovascular and lymphatic systems and blood. So there are quite a few in this chapter just because it does cover more than just the cardiovascular system. Again, just pay close attention when letters are capitalized and when they're lowercase, and also spacing on a few of them. Again, some of them could have more than one option, such as electrocardiogram could be ECG and EKG, either one. So here we have the definitions, and they want you to come up with the abbreviation. So again, you can pause the recording, write your answers down on a piece of paper. So again, I'm just going to pop up the answers. So nuclear medicine scan that visualizes the heart from several different angles, producing three-dimensional images used to assess damage to the cardiac tissue, is the SPECT scan. Pertaining to the atrium and ventricle would be AV. Emergency procedure consisting of external cardiac compressions may be accompanied by artificial ventilation would be CPR. Pertaining to within a vein would be an IV. And then sudden symptoms of insufficient blood supply to the heart indicating unstable angina or acute myocardial infarction would be ACS for acute coronary syndrome. What is the name of the abbreviation for the term meaning record of the heart using sound waves? And that would be echo for echocardiogram. And then we have abbreviations, and then they want you to come up with the meaning. So we have PTCA, percutaneous transluminal coronary angioplasty. CBC would be complete blood count. CABG, coronary artery bypass graft. HF, heart failure, and HTN is hypertension. So let's finish up Chapter 10 with Objective 8, applying medical language in clinical context. So we're going to read the scenario. Again, it is in your book, and then answer several questions that pertain to it. A 55-year-old man presented to his doctor with pain in the calf and swelling in the left foot and ankle. 3 days prior, the patient had completed trans-Pacific airline travel, spending several hours in a sitting position. He has a history of varicose veins, no previous history of hypertension or thrombophlebitis existed. Physical examination revealed an edematous left lower extremity and a tender calf. The pedal pulse was intact. A Doppler ultrasound was obtained, which revealed deep vein thrombosis. The patient was hospitalized, and subcutaneous low molecular weight heparin was begun. Concurrently, Coumadin was started and will continue for 6 months. The oral anticoagulant will be monitored monthly by prothrombin time. So now they're wanting us to answer the questions. True or false? The radiographic image was used to diagnose deep vein thrombosis. And in this case, again, if you have to reread, that's fine. It was not, so it's false. It was by the Doppler ultrasound, so not an actual radiographic image. Number 2, the patient was diagnosed with what? Again, it was deep vein thrombosis, so what does that mean? And that's going to be letter C for a clot in a vein in the lower extremity. And then number 3, a blood test will be used to determine what? And again, going back, and that's going to be D, certain coagulation activity defects. Now we're going to interpret medical terms. They're giving us a definition in italics, and we're choosing which term in bold best fits it. So the first one, yellowish fatty plaque within the arteries. Again, if you need to pause it, please do so. But hopefully you're choosing the second option, atherosclerosis, the ATHEROSCLEROSIS option, because athero is the arteries. Number 2, inflammation of a vein associated with a clot is called what? I'm hoping you're choosing the last option, thrombophlebitis, because thrombo means clot and phlebo means vein, and of course itis means inflammation. Number 3, inflammation of the middle muscular layer of the heart. So again, they all end in itis, which all means inflammation. So which one is middle muscular layer of the heart? And that's going to be the middle option, myocarditis, because myo means muscle. Number 4, another name for a heart attack. I've said this earlier in the recording, and that's going to be a myocardial infarction. The surgical excision of a thickened artery interior is what? So first of all, if we look at our suffixes, ectomy means excision, so our only options are the first one and the last one, and then thickened artery interior is going to be the last option for endarterectomy. Number 6, an acute infection caused by the Epstein-Barr virus is what? And that's going to be the infectious mononucleosis. Remember the mono or the kissing disease. Number 7, reduction of body temperature to a low below normal result in a condition is called what? So which of the prefixes mean below? And hopefully you're choosing the first one for hypothermia. And then thermia is your temperature. Let's see, number 8, blank is used to examine the condition of the heart and surrounding blood vessels. Again, just looking at your options, that's going to be the first one, cardiac catheterization. Number 9, an abnormal cardiac sound heard through auscultation or blank is sometimes a result of many episodes of rheumatic fever and inflammatory disease occurring in children. And that's going to be a murmur. If it's heard, abnormal cardiac sound is a murmur. Number 10, the doctor uses what to visualize the blood vessel and guide the laser beam to open blocked arteries, and this procedure is called a what. So first of all, what is used to visualize the blood vessel and guide the laser beam? That is going to be an angioscope, because that's the actual instrument, and that procedure is going to be an angioscopy. Now number 11, the following is a nuclear medicine test used to diagnose coronary artery disease. Again, you might just have to go back and review those options, but it's going to be the Sestamimbi test. Number 12, each time the patient came in contact with house dust, she immediately began to sneeze and experienced rhinorrhea. She visited a blank to seek relief from her symptoms. So she is allergic, so she would see an allergist. And number 13, peanuts are an antigen that can trigger an exaggerated life-threatening reaction, or hopefully you are choosing anaphylaxis. That is the life-threatening part of it. And that will end the recording for Chapter 10. You can now go to eCampus to complete the assignments.